Hello. So what are some common psychological responses to isolation and quarantine? There are three major psychological responses: fear, frustration, and boredom. Fear for our own health, fear that we may get infected, but also fear of infecting other people, our loved ones, especially the elderly who may be at increased risk of dying from COVID-19. Then there is frustration. Frustration for not living the life that we planned, the life that we worked so hard for to put together. We made it back to the gym and now there's no gym to go back to. We made all these great plans for the summer, for all traveling and for having our kids go to summer camp, and all that is in jeopardy. Very frustrating. And of course, boredom. Social isolation is much more taxing to our psyche than we appreciate. There are only that many video games that we can play. There are only that many episodes of Ozark or Joe the Exotic that we can watch. Only that many jigsaw puzzles that we can put together. So after a while, this social isolation starts getting on our nerves. And of course, the longer it lasts, the more severe the psychological consequences of the pandemic. Now, some people ask me, will people develop frank psychiatric disorders from COVID-19? And most likely, the majority of us will be just fine, will be okay. Only a small number of people, a minority, will develop psychiatric symptoms, psychiatric disorders, perhaps something like post-traumatic stress disorder, and these people will require specialized psychiatric treatments. Now, people ask me what may be some day-to-day recommendations for keeping ourselves well. Well, two ways of thinking about it, two parts to it: physical health and mental health. In terms of physical health, pay attention to the four pillars of physical well-being: nutrition, exercise, sex, and sleep. And on the psychological side, probably one of the most important things is to safeguard and develop routines. Safeguard the routines that you have already in place and develop new ones to accommodate the new realities of our lives. And this will have an effect of giving your brain a sense of normalcy, which is just so important for our psychological health. Finally, recruit your own heart, recruit your own sense of altruism. It's not that just we're being mandated to shelter in place. We also want to do this. We're doing it because we want to help our fellow human beings. We want to make sure that everybody in this society does well and thrives. And of course, this is an altruistic stance that can be very helpful for our own psychological health.